Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for Monday, February the 1st. We're honored to be here on the territories of the Lekwungen-speaking people, the Songhees, and the Esquimalt First Nations. Just to give you a sense of this week, Tuesday, Wednesday, and Thursday, you'll get written briefings with updates on COVID case counts and other relevant information with respect to the pandemic at around 3 o'clock. On Friday morning, Dr. Henry and I will be briefing on the latest modeling and the state of the pandemic on that day, which is February 5th, which is also the day when the current orders expire, the public health orders expire. So there will be a briefing on that day that will address both modeling and that question. And so with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you and good afternoon. Today being Monday, we're reporting on 3 periods of time between Friday and Saturday, January 22nd to 23rd. We had 408 new people test positive for COVID-19. Between Saturday and Sunday, the 23rd to the 24th, there were 473 new cases positive for COVID-19, and in the last 24 hours, 277 new cases were diagnosed. That leaves us with 1,158 people diagnosed with COVID-19 over the past weekend, 4 of whom were epidemiologically linked, bringing our total number of people who have been diagnosed with COVID-19 to 67,937 people in British Columbia. Of the new cases, 295 people live in the Vancouver Coastal Health Region, 493 people are in the Fraser Health Region, 78 people were here on Vancouver Island, 194 people were in the Interior Health Region, and 98 people live in the Northern Health Region. We now have 4,134 active cases around the province, 289 of whom are in hospital, 79 in critical care or ICU. An additional 7,242 people are under active public health monitoring, and 61,117 people have recovered. Over this past weekend, we've had an additional 21 people who have died from COVID-19 here in British Columbia, bringing the total number of people in British Columbia who have died to 1,210 people. And as always, we know how challenging a time this is to have somebody who's passed away from COVID-19 in particular, and we want to send our condolences and thoughts to the families, the caregivers in our communities who've lost our elders and seniors for the most part across the province. We have one new healthcare outbreak at the West Side Care Residences group home, and outbreaks have now been declared over on one of the Burnaby Hospital sites and at Brookside Lodge Long-Term Care. This leaves us with 24 active outbreaks in long-term care or assisted living, 8 in acute care units, involving 801 residents and 430 staff. As you know, we are starting this month of February with a limited vaccine supply, but we hope, and we've been told, that we'll be increasing our available supply as the month progresses. Importantly, while fewer people are receiving doses this week, we are continuing with our preparations to have widespread immunizations underway on a bigger scale than we've ever done before across the province in a few short weeks. We do expect that we will receive additional Moderna vaccine later in this week, although it's slotted for coming the week of February 1st. We understand the vaccine won't itself arrive probably until Friday of this week. However, we are expecting a small amount of the Pfizer vaccine to be coming earlier than that. And since the start of our immunization program, we have immunized 138,892 people with a single dose, and 4,491 of them have received a second dose. So that is a really important part of our program, making sure that we are protecting those in our long-term care facilities as a really important key first step. I want to talk a little bit today about these variants of concern that we're seeing across the world and here in British Columbia. To date, we have had 18 cases confirmed of a variant of concern. 4 of these confirmed cases were the B1.351, which is the variant that was initially identified in South Africa. 3 of these cases were unlinked community cases, and 1 was a contact of one of these cases. In addition, we now are up to 14 confirmed cases of the B117, or the variant that has been associated with the UK. That includes 7 new cases, additional cases that were confirmed over this weekend. To give you a sense of where these cases have been, the South African variant have been all in, 3 in Fraser Health and 3 in Vancouver Coastal and 1 in Fraser Health. As you know, we are actively trying to determine where the people involved acquired their infections. Of the 14 confirmed cases of the UK variant, 4 of them are on Vancouver Island, 1 a traveller from the UK, and 3 additional contacts in a close household of that person, 1 in Vancouver Coastal and 1 in Interior Health, also travellers directly from the UK. 8 of the cases were identified in Fraser Health, and all of them, 7 of the 8 were travel related to various places, including through the UK, through Europe and others, and 1 was a contact of a traveller. So we have been working with our colleagues across the country, but particularly within our laboratory network here in BC, to have 3 different ways that we're looking for these variants. One is as random sampling of surveillance of cases in areas where we are seeing increased cases and growth and outbreaks. So I mentioned last week we've done some specific sampling in places like St. Paul's Hospital, where we saw rapidly growing outbreaks, in areas around where we've seen people test positive, particularly in the community cases. We are doing testing of all travellers who've come into British Columbia from international destinations who have tested positive for COVID-19, and we are targeting specific groups where we've seen in other parts of the world may be differentially affected. And we're, for example, doing whole genome sequencing of all cases in young people and school-age children. This we're doing we've done about 11,000, a little over 11,000 whole genome sequences here in British, a high percentage compared to our cases overall, and we are ramping up. Currently, we have an ability to do about 500 whole genome sequences a day, but that is, we're looking at measures to increase that and to do, the lab is working on ways of detecting part of the genome to be able to indicate if an isolate is likely to be one that is carrying one of the variants of concern. So those, we expect to be able to step up our surveillance over the next couple of weeks to be able to do that as well. So you may have heard that today one of the contacts of a confirmed case is attended a school in the Fraser Health region, the Garibaldi Secondary School. And because we don't know a lot about these variants, but we have concern that they may spread more easily than we are seeing with other strains of this virus, we have now worked with Fraser Health and the laboratory in Fraser Health to do testing on all of the cohort that was with that person in the school. So that's about just under 80 people. And they will be tested with our rapid tests, which are good for screening and being able to test on site, but also will be tested using PCR, because we know that the rapid tests can miss positive cases that are asymptomatic in particular. So that is undergoing today over the next few days, and will give us a better understanding if there's any ongoing risk from this potential exposure event. So this is one of the things that is most concerning for us right now, that we've seen in other parts of the world and here in Canada. Reports on the weekend from colleagues in Ontario and in particular have shown that we are seeing some transmission in communities of this variant, and there's been a number of outbreaks in long-term care homes in Ontario that have been associated particularly with the UK, the B117 variant. So we have stepped up our surveillance. We are monitoring and testing in outbreaks particularly, and we'll present more data about how we're doing that surveillance later this week on Friday morning as well. But just to know that this is one of the things that is factoring into all of the decisions that we have to make together over this next coming weeks. We have vaccine, but it's coming in small amounts, and we've been in a little bit of a pause because of vaccine supply. There are other vaccines that are currently being evaluated by Health Canada, and we're hopeful that many of them may become available for use in the coming weeks. But right now it's important for us to maintain our precautions that we have in place, so that we're not transmitting widely in our communities until we can get a better sense of where these variants are, how they're spreading, and protect each other from them. This also reminds us that gatherings of any size in our homes or elsewhere are very high risk right now and should not be happening. We know that over the last few weeks, we have seen a decrease in young people, school-age children, in rates in school-age children, and in older people as we've been able to protect our most vulnerable. But we have seen an increase in people in the 19 to 40-year age group for a variety of reasons, some of them related to workplace exposures, but many related to social exposures. We know this coming weekend is the Super Bowl weekend, and the following is both Lunar New Year and Family Day. And then, of course, we have spring break that's coming later in this month and into March. These are occasions when we would normally take some time away or get together with friends and family in our homes, at restaurants or bars, or elsewhere. Like the December holidays, this year we do need to celebrate safely. We have light on our horizon, but we are not there yet. The vast majority of people in BC know this and have clearly demonstrated. Then when you know what to do, and you do the right thing. We know this past weekend, WorkSafe BC was working with Vancouver Coastal Health, with our public health inspectors, to enforce the rules and regulations to try and get a handle on some of the areas where we have been seeing surges. And we know, particularly this past weekend, they spent a lot of time in Whistler and a few other areas, making sure that people understood what the restrictions were and why. And what I heard from these reports is that in many cases there were very good plans put in place, but later in the evening people were coming together in a restaurant that might have the seating and might have the spacing and might have everything done right, but it was very difficult for the owners, for the staff who worked there, to keep people from congregating. And we know that that's where this virus can be transmitted. And we've seen that in Whistler and in other communities around the province. We will be providing an update on Friday about the orders, but I am calling on everybody right now, hold off on the Super Bowl celebrations this year. You should not be planning, whether it's at home, in a bar, a restaurant, viewings of the Super Bowl. If we are not able to control this and start seeing spread again, we can undo all the good work that we have done. We need to respect the staff and not put them at risk. Stay small, stay apart, keeping everyone safe so that we can keep our bars, our restaurants, our retail spaces, our workplaces open. And this applies to everyone in British Columbia and anyone who's considering coming here to our province. Every new day and every new week, we have an opportunity for us to keep this going and break the chain. Whether it's out for a day skiing at your local mountain, what you do at work, or how you shop for groceries, what each of us does matters. And we have to remember to give people some space, to keep our safe distance, to wear masks when we're in those indoor public spaces, to stay away from others if we're not feeling well, and to not have those gatherings where we can potentially pass this on to the people we are closest to. We need to stay apart, stay small, and stay local as we get through this next few weeks and make our way into spring. There are brighter days ahead, but we need to remember to be kind, to be calm, and to be safe.
Thank you very much, Dr. Henry. First of all, just I wanted to pass on my condolences and my thoughts to the families and the friends and the caregivers of the 21 people who passed away over the last 3 days from COVID-19 in BC. It is a significant loss, 4 from Friday to Saturday, 14 from Saturday to Sunday, 3 from Sunday to today. It is a huge loss for people when this occurs at any time, and particularly now, particularly during this pandemic, particularly for those who are most vulnerable. It is profoundly unfair to people. We want to know to all the families how much they're in our thoughts today. Just a couple of small things just on the dates of the weekend. Yeah, we were just talking about this that the weekend obviously was January 30th, 31st, and February 1st, and I think there was just a problem on the note sheet there that was the 3 days on the weekend in any event. And just one other thing with respect to vaccine administration, that the total doses administered is 138,892, 134,401 of those are first doses, and 4,491 are second doses. I wanted to, as we do on Monday, briefly report on the PPE we've received over the last 2 periods since my last update on Monday, January the 18th. In that period, we received 30,670 N95 or equivalent respirators, an extraordinary 30,030,700 surgical or procedure masks, 221,722 pieces of eye protection, 16,427,975 pairs of gloves, and 1,636,310 gowns. Clearly, there is positive news in long-term care and assisted living and independent living. As you know, on January 15th, we had 49 outbreaks in those 3 types of facilities, and that number, as Dr. Henry has just reported, is now 24, which is a significant reduction. And in the number of people involved in those outbreaks has been reduced by 1,030 over that time, which is obviously a significant thing, and we're very, very pleased in the sense that it demonstrates that the immunization that's been done, that the vaccines that are being used are proving to be effective in long-term care, effective with our elders, and that, of course, is heartening. But along with administering the vaccine, reducing the spread of COVID-19 in our communities is essential to infection prevention and control actions in long-term care and assisted living facilities. As you know, and as I've just noted, there are fewer outbreaks than there were 2 years ago, but there are still 24 outbreaks in independent living, assisted living, and in long-term care, which is still a significant number. And that presents real challenges for the staff, especially in care homes where many staff people have become sick, and obviously for residents, and it affects in a profound way quality of life. So I want to announce today that the Ministry of Health has engaged the Red Cross to provide response teams consisting of non-clinical and administrative staff to select long-term care and assisted living facilities. Priority sites are identified initially by Fraser Health and Vancouver Coastal Health. We'll see their efforts bolstered by Red Cross provision of non-clinical support services. It'll work this way. A Red Cross assessment team visits and performs an epidemic prevention and control assessment to identify areas of need and to familiarize Red Cross staff with the facility. The assessment teams work with health authorities to identify supports required and understand infection control, prevention and control work already underway. Then teams of support aides are assigned to the facility. Typical deployment at a site includes a team of about 20 individuals, 2 teams of 10 to cover 7-day-a-week services for a maximum of 4 weeks per site. We are currently identifying, it's a small but important program, up to 5 priority sites in Fraser Health and Vancouver Coastal Health. It should be remembered that the protection afforded by vaccination, while important and while demonstrating its worth at the present, isn't immediate. It takes about 2 weeks for the first shot to reach full effectiveness, and that's 2 weeks when we need to be especially vigilant. And of course, everybody who's received their first shot will need to receive their second shot. The addition of the Red Cross to support efforts at this time is appropriate and significant, and it's intended really to support the quality of life in long-term care. It's an important step in our ongoing pandemic response, and I thank and recognize the Health Employers Association of BC, the Hospital Employees Union, the BC Nurses Union, the Health Sciences Association, the BC Government Employees Unions for their efforts to ensure that we can deploy the Red Cross teams immediately, and as I say, up to 5 care homes. In closing, we're obviously at a particular moment in the pandemic, and it's a serious one for everyone to consider. We obviously feel good about the amount of vaccine we've received so far. Our only wish is that we would have more sooner, but we are working hard to prepare for that. The anticipation of what this might mean for all of us later in the year is there. Yet at this moment, even in this weekend, we are averaging just under 400 cases a day, and sadly, 7 people a day passed away. This is a moment when we have to continue to take actions, to act to stop the spread. It determines in no small way, in every important way, what our pandemic will look like in the near future. This is a very important moment, and we ask everybody. Dr. Henry talked about Super Bowl Sunday, but really all of the events that are before us, the Lunar New Year events, other events around Family Day, and the events in the coming weeks, that we have to really, right now, support and follow public health guidance and public health orders. It is critically important, and particularly when people are out where they can be out, that they respect staff people who provide service to people. This time, this moment, can be the moment we continue to reduce, continue to flatten, continue to reduce transmission of COVID-19 in our province, and it will be important that we do so. As I've noted last Friday and several times before that, our expectation right now is to be able to vaccinate about 10% of people by March 31st. Indeed, as of June 30th, on our present plan, what we're told by the federal government, that number will be less than 50%. That means that we have to continue to follow the guidance and the advice for the foreseeable future. And I strongly encourage everyone to do so. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence de 24 heures chacune, soit celle du 29 et 30 janvier, celle du 30 et 31 janvier et celle du 31 janvier jusqu'au 1er février en mi-journée. Il y a eu 21 décès liés au COVID-19 durant ces périodes de référence. Et nous offrons nos condoléances aux familles et aux amis des 1210 personnes décédées du COVID-19 et à tous ceux qui ont perdu des êtres chers au cours de cette pandémie. Pour la première période de référence, nous avons eu 408 nouveaux cas. Pour la deuxième période de référence, nous avons eu 473 nouveaux cas. Au cours des dernières 24 heures, 277 nouveaux cas se sont ajoutés. Parmi l'ensemble des cas confirmés de COVID-19, 289 personnes sont actuellement hospitalisées, dont 79 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everyone on the phone, please press star 1 to enter the queue. You are limited to 1 question and 1 follow-up. I would also ask that you please unmute your phones. You're not audible until your name is called. First question today is from Richard Zisman, Global News.
Dr. Henry, how large is the concern that there has been spread of the variant in the school setting? And with this concern, not knowing if there was spread, is the province providing any additional restrictions or rules within schools around first overall testing and masks as well?
Yeah, so we have been, as you know, doing surveillance for these variants of concern for some time, and we've been targeting school-age children, and so far none of the tests on anybody who's in the school system have turned up positive. So the initiative we're doing today at the Garibaldi School was because one person who was in the school did have a positive COVID test and was a contact of somebody who had a variant. So we're obviously going back and testing them as well, but we want to make sure that there's no other spread in the school. So that's the reason we're doing this. And as we learned in the use of the rapid tests in the correctional facilities, for example, they are helpful in giving us a sense of what's going on, but they're not accurate enough on their own. So we're doing both testing with the rapid test and the PCR test. Although for these mostly young people, we are going to do the spit and gargle so they don't have to have 2 nasopharyngeal swabs. So we know that transmission is very uncommon in our schools, and we have been working with the school communities, and I've said a number of times, Dr. Reka Gustafson, who works in my office, has been the lead on that for the last few months, pulling together what we know and revising and updating the guidance. And yes, there will be more about that in the coming days. I do think it's important to enforce the mask wearing that we have in the school setting, and particularly in light of variants that we're seeing in our community, thankfully right now in small numbers, but this is a period of time where we're still trying to figure out what it means and how it's spreading across Canada and across BC.
Do you have a follow-up, Richard? You there, Richard?
I am.
Go ahead.
I'm sure you've heard, Dr. Henry, that there were some charges laid over the weekend under the Health Act in connection with downtown party that we've spoken about here before. Do you think the operator being arrested and charged is enough of a deterrent, or do you think he should go to prison if the allegations are proven?
Yeah, so it's not my job to mete out the punishment for these types of offences. I do think it was offensive that was happening, and I am appreciative that the police took the action they did. I think all of us are doing our best to follow the rules, and we understand why. And when people are flagrantly violating those rules, then that's why we have the orders in place that action can be taken. But that is up to the judicial system to make a determination about what should happen with that person. But I think we all need to understand that the little bits that we do are important, and we know that for the most part people are doing the right things.
Next question is from Chad Clausen, CFJC.
Hey, Dr. Henry, thanks for taking my call. I'm going to I know the focus here today is on exposures in schools, and I'll get to that in a little bit. I did want to shift gears a little bit to ask a sports-related question. As you probably know, last week, the Western Hockey League received approval in Alberta to start play later this month. The league is proposing a hub model here in BC. Sounds like Kamloops and Kelowna. Weekly testing is going to happen. What's the latest on that, and what is it going to take for the government basically to approve the start of play here?
Yeah, so as you know, we have restrictions on sports around particularly allowing youth and young people to have some activities. We are in ongoing discussions with Via Sport, which is the provincial organization that oversees a lot of these guidance. And yes, we are talking about what is rational given our epidemiology and what's happening around the province. I have not seen that particular plan that you referenced, but we have been in discussions with the Western Hockey League about potential for a season at some point in the future when the epidemiology allows it.
Chad, do you have a follow-up?
Just to follow up, just totally unrelated to sports, but back to the school concept. I know there's a school here in Kamloops that's seen 4 cases, 4 exposures, including apparently a community transmission within the school here in the last couple of weeks. And I know that's the case in the lower mainland as well. But at what point would you guys consider shutting down a particular school if there's that many cases within such a short period of time?
Yeah, so as from the very beginning of this, and I know we haven't had a lot of exposures outside the Lower Mainland, and that's because we know that what happens in the schools reflects what's happening in communities, and we've started to see increased transmission in communities in the interior and in the north, and even here on the island more recently. So yes, we do see exposure events with very little transmission in the school. And the local MHO works with the school to make sure we know who was in contact with who. And we have a definition of a cluster, so a small amount of transmission within a cohort, or an outbreak, where we have more widespread transmission between cohorts. And we've had a few outbreaks around the province. But right now, it's between the local MHO, the school MHO, working with the school community to assess the risk for each particular school. So in some cases, when several cohorts have had to go home or to be isolated because of risk of transmission, or when a number of staff have been affected, our educators in the school system, that the school doesn't have enough people to run safely. Those are instances where schools have closed, sometimes on the advice of the MHO and sometimes on the schools and the superintendent's advice, depending on being able to function safely. So there's a number of factors that go into it, but clearly every time there's an exposure event, we need to work through, what was being done, were the precautions being followed, who's at risk, and that is what local public health does with each and every school.
Next question is from Katie DeRosa, Vancouver Sun.
Hi, this question is for Minister Dix. It's in relation to the allegations that you were asked about on Friday in relation to the pregnant mother in Kitimat. And Mary Ellen Taprella-Fond has sort of weighed in, and I'm wondering what the progress is on the task force that resulted after her report. Has that task force been set up, and have those Indigenous liaison positions been implemented in the health authorities?
Thank you very much, and first of all, welcome, Katie, to your new position and here in Victoria. And you'll expect, I think, this week, the release from Dr. Taprella-Fond, the full data report, and I'll be providing an update on those questions at that time. I think the progress has been really good. As you know, we have a new Associate Deputy Minister of Health, Don Thomas, who's Vice President of Vancouver Island Health Authority, who's come in and taken leadership of the provincial government part of those initiatives. We have all of the health authorities fully engaged, and the First Nations Health Authority and the First Nations Health Council playing a crucial role in all that. So there's significant progress, and I'll be reporting this week in some detail on that. And so I think in the next couple of days you'll get answers to those questions and quite a few more.
Do you have a follow-up, Katie?
Yes, I do. So can you say specifically if those Indigenous liaison positions have been created? Because again, that's the family is saying that the Kitimat General Hospital should have an Indigenous liaison person because they're concerned both about the pre-care and the aftercare for this particular mother.
I agree, and I think we are proceeding with hiring of 32 liaison positions, 5 in each Health Authority and 2 in Providence Healthcare, so that's 32. And I'll be giving you a specific update on that, but I strongly believe that adding those liaison positions, including all, in addition to other work being done, will greatly strengthen the response of health authorities to addressing and developing anti-racism as a guiding principle in those health authorities. So I think those positions are important. And as I say, this week you'll expect an update on all of the issues related and all of the follow-up and all of the actions that have been taken since the report was put into place. I had the opportunity to report on many of those at the national conference that was done on anti-Indigenous racism in healthcare, led by the federal government this past Thursday, and I'll be reporting in detail on that. As Dr. Turpin-Lafont reports, I think really the extraordinary, very challenging data that has been developed through her comprehensive report on racism against Indigenous people in our healthcare system. So we'll have the details on that soon in terms of who's been hired, what the process is, but the expectation, we're proceeding and created and have funded 32 places, and we'll have more information out for you later this week.
Marcella Bernardo, News 1130.
Hi, everyone. I just wanted to ask you about some Whistler hotels are now posting ads encouraging people to come and visit. So doesn't this only create more confusion about what is allowed when you've repeatedly told everyone that we need to stay close to home?
Yeah, and you know, these are challenging times for the hotel business. We know it's challenging times for the travel industry. We know, and we are connecting with the industry. I've met with them once as a larger group. I've met with the restaurant associations and the beverage associations a few times, quite a few times actually. My office meets regularly with them as well. So these are questions that we will bring to them. As you know, we have been discouraging, particularly out of province and absolutely out of country travel right now as being too risky. As well, we're asking people to stay local and to go to their local ski hills, stay in their local communities. That's really important to support your local community and the businesses in those communities. So it is not something that I would support at this point, advertising outside of the province.
Follow up, Marcella?
Yes, you spoke a few minutes ago about the WHL, and there are now concerns being raised about junior players in the BC Hockey League wanting to start up again. We're hearing from parents worried about the mental health of their kids, and time is running out for them to apply for scholarships or a chance to vie for contracts at higher levels. So what's being done to get them back on the ice again?
Yeah, and as I said, we know that physical activity is important for the mental health and emotional health of children as well. Not to say that music and arts is not important, because we know that is important as well. But much of that can be done remotely, and we have been working with Via Sport to look at how we can make sports more available, especially to our children and youth. But I will just say as well that this is not unique to BC. This is something that is happening globally, certainly across the country and across the continent. And we know that leagues are taking that in, universities are taking that into account as well. So these are things, it's going to be an extraordinary year for everybody. And I know that there's provisions being taken, but absolutely we want to, as soon as it is safe to do so, to be able to have those important experiences for young people in particular.
Next question is from Binder Sajjan, CTV.
Hi there. Dr. Henry, you said a couple of minutes ago not to make Super Bowl plans. Does that mean that restaurants can continue to operate as they do now, or are some type of restrictions coming?
Yeah, so those are discussions that we're having again with the industry. If the restrictions are followed the way that we have them, we know that those environments can be safe. So it is both sides here. If we know, my message to people who are running bars and pubs and restaurants, you have to make sure that you have the important safety provisions in place. And WorkSafe BC and our environmental health inspectors will be stepping up their monitoring and enforcement of that. But it's on us as well. We should not be going with a different group every night to a restaurant. We should not be breaking those rules that puts staff and restaurant businesses at risk. So if we want to be able to safely have these moments to enjoy, then we need to do them differently this year, and we all have to take responsibility. We're the only province right now where we have been able to keep these businesses open, but it's because we have these safety plans in place. And when we start to flaunt those, that's when we're seeing transmission happen, both to staff and between people in those environments. So we've seen some of the enforcement that happened this weekend in Whistler. So yes, it's safe to watch the Super Bowl, but do it with your household. Do it in a way that doesn't increase the risk to everybody.
And just to be clear, many people have Super Bowl or Grey Cup parties in their homes, and that is not on this year. This is the year to watch it with people living in your household, to watch the Super Bowl game with people living in your household, and only those people. Those environments are the wrong environments right now. Occasionally in the past I've attended Super Bowl parties, Grey Cup parties, and they're events that are almost designed for the spread of COVID-19 and the various things that occurred at them. In your home this year, it's only people in your household. So I understand your question was about restaurants, but in your home, no Super Bowl parties.
Bender, do you have a follow-up? Oh,
I did.
sorry.
The Stanley Cup finals, which are going to be in July, we'll be in a different place in July. I hope.
Bender?
Well, I'm an NFL fan, so Dr. Henry, I also wanted to ask you, I mean, you're kind of hinting at where we're headed with these restrictions. And, I don't expect you to tell me today, what the decision will be Friday. But how much of a concern is it for you that people say, look at this dude's having this party in his penthouse, allegedly. All I want to do is gather with one friend in my backyard, 6 feet away for 20 minutes. How worried are you if these restrictions continue too long that people will not listen?
Yeah, it is a terribly challenging time, and people are listening, and most people are doing the right thing. Sure, sit outside with a friend for a few minutes, go for a walk. Those are not risky activities in the grand scheme of things. It's the indoor parties with different groups of people every night. And we know that's happening. Where we're seeing transmission in many of the communities is in young people. And we know that that is linked to small social events that people are having. So it's not okay to have my one or two friends that I have dinner with tonight, or my one or two friends that I go out with today, and then a different group tomorrow. And that's our nature, unfortunately, when we're young, and that's what we want to do. We're at that period of time where we want to go out and make connections with people. We have to have some self-restraint right now. We will be able to do that again. But right now we're seeing that that's how this virus is getting transmitted, and we don't yet have enough people protected that we aren't going to get spillover into people who are going to end up in hospital and people who are going to, unfortunately, have serious illness from COVID. So we have to be able to keep to our small group, find ways of connecting with each other and supporting each other to do this right now. To get us to the period where we have enough vaccine that we can protect enough people. And it's not people, maybe I'll just leave it at that. I understand how hard it is, particularly for young people at this point in time, but we also know that young people care about their communities, and they care about their families, and they care about doing their piece. So I know that when we say this, people know what to do now. And yes, it is challenging. We have this concerning variant that is causing havoc in other countries, and we don't want that to happen here.
Justine Hunter, Globe and Mail.
Hi, thank you. Dr. Henry, I don't know, 18 cases of with the variant of concern isn't a huge sample size, but have you got any indication whether there's a younger cohort involved, if the symptoms are in any way more serious for younger people? Like, I'm just wondering if you know anything can talk about how this might change our path in terms of the pandemic in BC.
Yeah, I'm hoping it doesn't, but we do know that it is a younger group of people. We know that it is younger people that are traveling. So when I say younger, I mean people in their 30s, 40s. So between 19 and 50, for the most part. There is one younger person, a teenager. But these are people, for the most part, who have traveled internationally and come back. Except the 3 cases that we know of with the South African variant. So it is very much travel related. We're not seeing a lot of it in our community, despite the surveillance that we're doing around different outbreaks, etc., and the random sampling that we're doing on a routine basis. But it is a concern, because every time this is introduced and it can spread, we can see in other countries how it has started to spread rapidly. And that is what we're worried about right now. It's hard to know what's going to happen in the next little while.
Follow up, Justine?
We've all given up on trying to guess at the future, I know, but you mentioned 3 different types of surveillance that you're doing. I'm wondering, what is the total amount of testing of this type that we're doing on a daily basis, and how urgent is it, do you feel, to increase that capacity for surveillance?
Yeah, so I mentioned we've done about 11,000, so it's the whole genome sequencing that allows us to pick up these specific different strains or variants of the virus, and the whole genome sequencing we can do about 500 to 600 a day. We're trying to ramp that up to 700 to 1,000 a day if we can. As you know, we've had about 500 cases a day, so that doesn't allow us to do all of them, and the process is a little bit slower, so it takes several days to do the whole genome sequencing. So we have been doing, as I mentioned, 3 things. One of them is routine surveillance, so randomly samples, particularly in areas where we have higher caseloads. We've been doing specific outbreaks and areas where we're seeing rapid increase in cases, and we're doing all of the people who test positive after travel. So the priorities change a little bit depending on what's going on. Last week over the last 2 weeks, we were very concerned about the rapid spread in a couple of hospitals. So we made sure that some of the tests from those hospitals were checked to make sure that it wasn't a variant causing that rapid spread. The other one that we're watching very carefully is people who test positive after vaccination, and now that many people are 2 weeks at least past their first dose, making sure that we're not seeing any variants that would affect our immunization program. And so far we haven't. But those are targeted things too. So the BC CDC lab is coming up with a strategy. They're working as well with our counterparts across the country to come up with a national strategy for screening, to try and leverage all of the resources that we have, including the National Micro Laboratory in Winnipeg, laboratories in Quebec, Ontario, Alberta, to do whole genome sequencing as well.
Next question is from Shannon Waters, BC Today. Shannon, are you there? Okay, we're going to move on to Zara Premji, CBC.
Hi there. This is for Dr. Henry and Minister Dix. So some BC cancer patients who must travel to the U.S. regularly for their treatments are saying they should be granted quarantine exemptions like truck drivers because their travel is essential, and the new measures forcing people to quarantine at the traveler's expense is particularly burdensome to them. So would BC support travel exemptions for people seeking medical treatment in the U.S.?
So that's a bit of a challenging thing, and we've worked with the federal government, who has jurisdiction, of course, on international travel. So we do know as well that people who are traveling for that type of treatment are going into a medical center, which is a higher risk environment in the U.S. So there is some need for them to isolate so that they're not exposing others around them, both when they're in the U.S. and when they come back. And we've been working with our federal counterparts about how they can best support people. But it's a very difficult question, and it is a national, both the Canadian Border Services Agency and the Public Health Agency of Canada have jurisdiction over that type of travel. I think there's also a role for testing that can support people who need to go back and forth for treatments, for example.
Sarah, do you have a follow-up?
Yes, and you mentioned this topic earlier, of course, but regarding the possible exposure to one of the variants at a high school in Maple Ridge, do you plan to add more protocols to schools like rapid testing or a mandatory mask policy within the classrooms? If not, why not? And can we also get that in French, please?
So I think if you look at the safety plans for schools, masks are one part of it, and there are many different parts that reduce the risk of transmission and reduce the risk of widespread transmission in schools. And so masks absolutely are part of that. And as I mentioned, Dr. Reka Gustafson has been working with the school team to look at where things are working and where things aren't working, and there'll be more information about that later this week. But masks have always been a part of, one of, but not the only safety factor in schools. In terms of testing, today will give us a good example. We do testing of people who have symptoms in schools, in the school setting, and we make sure that children with specific symptoms have testing, but also the adults in the school system need to be tested if they have any symptoms at all. Whether rapid testing in schools is of value is something that people have been looking at across the country. It certainly makes a difference when you don't have to use a nasal pharyngeal swab, although I will say the nasal swabs that have recently been approved by Health Canada finally are not yet available here, but we'll be looking for those as well. And of course, we can't use the spit and gargle test with the rapid test. So it's a little bit of a dilemma, but we also know that the rates of COVID in school-age children are very low, and they continue to be very low despite all of our testing. So it's not an environment where that would be where rapid testing would be the first choice in terms of an environment where it might be useful. It depends. It's useful for helping us detect if there's outbreak and transmissions when we think there's been a potential exposure, but routine testing with rapid tests is probably not something that would be valid in a school setting, and not the highest priority for sure.
Merci beaucoup. Il y a trois éléments de la réponse. Premièrement, de dire que les masques sont seulement un élément de nos efforts de réduire et de ne pas laisser passer le COVID-19 dans nos écoles. Donc, ça fait une partie de nos efforts, mais il y a maintenant des règlements qui existent pour les masques dans les écoles. Le dirigeant de la BC CDC, Reka Gustafson, qui est député, Dr. Bonnie Henry, fait partie d'une équipe de travail sur les écoles, sur l'éducation, qui fait un travail actuellement important pour assurer qu'il y a des mesures appropriées dans les écoles. Chaque école a un plan de protection contre le COVID-19 et il faut adhérer à ces plans. Et ça, c'est très important en ce qui concerne des tests rapides. Le Dr. Henry vient de dire que ces tests ne sont d'une manière quotidienne ou régulière, ne sont pas la réponse à une situation dans les écoles. que le taux de transmission parmi les élèves est parmi les moins élevés dans la société, mais de toute façon, c'est pas le meilleur élément ou la meilleure réponse à la situation dans nos écoles. Le travail continue, bien entendu, à fond, mené par le docteur Gustafson, et il y aura plus à dire, je pense, dans les jours et semaines à venir, parce qu'il faut continuer à travailler là-dessus d'ici jusqu'à la fin de l'année scolaire.
We have time for one more question this afternoon. For everyone listening, Dr. Henry and Minister Dix will release a statement with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bc.ca/COVID restrictions. And for information about the province's orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question today is from Laura Kane, Canadian Press.
Yes, thank you for taking my question. I wanted to know more about the Red Cross going into care homes. So first of all, I wanted to clarify the numbers. So teams of 20 are going to 5 priority sites. So can you confirm it's 100 Red Cross members total? And then what exactly are they doing in the homes? And why now? As you said, Minister Dix, the number of outbreaks was double 2 weeks ago. So why wasn't this a solution that was deployed earlier, and why has it become necessary now?
Well, it's something that we've been pursuing. As you know, we worked with the Canadian Red Cross last year during the pandemic when we were developing and expanding and looking to expand acute care space. And so this opportunity became available. We talked to the Red Cross. We asked them if they can provide these supports, and we've come to an agreement with them to do that. It's only, as you say, in up to 5 care homes. So the idea is approximately 100 people. And the idea really is to support the activities of the care home, particularly in care homes that have gone through either very challenging outbreaks or are currently going through outbreaks. All of the people involved, and it'll be, I think, just under 100 people will be immunized. We go to 5 sites, and it gives us the ability to simply support the people living at those sites, because the kinds of services, non-clinical services that can be provided make life and will make life better. And so this is something we wanted to pursue, and we've come to an agreement. We're announcing it today. And even though the number of outbreaks has declined, this is a very challenging time in long-term care. I think it in some respects it always is, but particularly in those facilities that are still undergoing outbreaks and challenges. So I think it's important to continue to do what we're doing, which is hire staff, support care homes, improve infection controls, and in this case, add additional supplementary support from the Red Cross. I think it makes a lot of sense, and the fact that there are fewer outbreaks now than there were 2 weeks ago is not a reason not to support those going through outbreaks, and care homes that maybe have just been through an outbreak but are facing and are dealing with the challenges and genuine exhaustion that comes with that. But mostly it's about improving the quality of life of people living in those care homes during a very difficult time, and I think it's a good idea. Thank you.
Oh, Laura gets one follow-up.
Sorry.
Laura, go ahead.
Thank you. So also for Dr. Henry, you said last week that all residents of long-term care homes and assisted living have received their first dose of vaccine. But we heard from a family member of 2 residents at Crofton Manor in Vancouver who said his parents haven't received their first dose. So that's an assisted living facility. So is it true that all residents have received their first dose at assisted living facilities? Can you just explain why that's the case, that for this couple anyway, they have not received their vaccine yet?
Yeah, so there's a couple of things. We've said that public health has been, or the immunization teams have been into all long-term care and registered assisted living that we know about. There are some that may not be part of the system, and there's some that are independent living that are not. Sometimes it's a challenge to know the difference between the two, but not everybody received the vaccine. There are some people, whether they didn't have didn't have consent or didn't have the ability to give consent, or people who were recently infected, and in some care homes that was a fair number of people, but we have very high rates of immunization in care homes, and there is turnover in care homes, both in staff and, of course, in residents. So people who missed the first offering of the first dose in care homes will be caught up as the health authorities go back into each of the homes for the second dose, and for some people that'll be their first dose. We're doing our best to try and catch people before they are admitted to long-term care, whether it comes from hospital or from the community, but there has been people who come and gone in the time period where between the clinics or between the vaccine offerings in the long-term care. I'm sorry, I'm stumbling over my words today. So most people have been done. All of the homes that we know about have been visited, and the health authorities will be following up to catch up people who were missed.
That's all the time we have today. Thank you.